Welcome everybody. With you, Dr. Magdi Abdulrazik, consultant of infectious disease, hepatology, and gastroenterology. Our topic today about in a medical first, a man with terminal heart disease gets transplant of genetically modified big heart. This is very important occasion occurred. A 57 years old Maryland man is doing well uh, 3 days after receiving genetically modified big heart in a first of its kind transplant surgery. As regard this man, he is called David Bennett, had terminal heart disease, and the big heart was the only currently available option, according to the release. Bennett was deemed ineligible for conventional heart transplant or artificial heart pump after reviews of his medical records. It was either die or do this transplant. He said, I wanted to leave. I know it's a shot in the dark, but it is my last choice. Uh, as regard the United States Food and Drug Administration granted emergency authorization for the surgery on December 31. Three genes that are responsible for rejection of big organs by human immune system were removed from the donor pig, and one gene was taken out to prevent excessive big heart tissue growth. Uh, Six human genes responsible for immune acceptance were inserted. As regard Bennett, doctors will need to monitor him for days to weeks to see whether the transplant works to provide life-saving benefits. He will be monitored for immune system problems or other complications. There are simply not enough donor human hearts available to meet the long list of potential recipients. Scientists said, we are proceeding cautiously, but we are also optimistic that the first in the world surgery will provide an important new option for patients in the future. Uh, we know that millions of human beings in a waiting list for donors, but we hope we have got the data to back up trying this now based on their animal studies. The United States has a terrible shortage of organs for transplants. We believe engineering animals' parts is the solution. Big heart valves have been transplanted into humans for many years. Surgeons successfully tested the transplant of genetically modified big kidney into a woman in New York who was brain dead. And this trial succeeded. Uh, as regard this trial of transplantation of big heart into human being, it is too early to call the heart transplant a success. That label will come off if the patient has a good quality of life for months. But it is still possible that he could die. Whatever the outcome, it is important for researchers to learn something that can be applied to future transplants. As regards this trial, it is very important success nowadays because we know that many people in a waiting list for donors. We know that the donors considered very few as regard the recipient. Many people need organ transplantation, especially heart, lung, liver, also pancreas. As regard this man, until now he still alive after 3 days of the operation, but we don't know if he will continue alive or no. So it is still early to say that the operation succeeded. But in future, this operation will open a great advance in transplantation from non-human to human being organ, especially from animals, especially from pigs, which modified genetically. As regards these operations, I think that will spread all over the world if this patient is still alive and continue his life. Many people who suffer from cardiac severe disease awaiting the success of this operation. Also, many patients who suffer from renal failure or pancreatic severe disease or liver cirrhosis, all these patients waiting the result of transplantation of organs from pigs to human being. If we succeeded, this will give life to many patients awaiting this the chance all over the world. And in the future, these operations will become more cheaper and more available in another countries other than United States. We know before in the past when the operations of liver transplantation from human being it was not available in our countries, but some surgeons traveled and know how to make these operations and come to our countries and make it easy, and now thousands of operations of liver transplantation now present in our countries. So I expect in the future it is possible to make this operation in the future in our countries. Thank you very much.